Good afternoon, everybody. My name's Scott McGann. I'm a health agent here in Falmouth. It's April 24th. Each week we give you an update about COVID-19 and sort of where we are in Falmouth and what to talk about. What I like to talk about is sort of similar to what I talked about last week. I've maintained the PowerPoint and presentation I had last week with some new slides and hopefully a little bit of new information. Again, if you need to visit falmouthmass.us. And there's some other websites I'll mention as we get further down for information. Health@falmouthma.gov is our email. It's our general email box. If you have suggestions of things you want me to cover on these Friday, I will. If you have issues independent of that, it does take us a little time to get back to you sometimes, and we do our best. We'll do our best to get back to you. Phone number is 508-495-7485. So as of today, we had a couple this morning. It's about 119 cases. Again, over 50% of the cases have recovered and are out of isolation. I've had some inquiries about that. People do get better. The way the cases roll, they roll and they don't get taken off the back end. But this is just the total number of cases we had since this started of known cases. Cases that are in our epidemiological tracking. So those are the number that we have. The VNA and myself, was mainly the VNA, continue to perform isolation and contact tracing on each case. I get involved if they need some more enforcement of isolation and quarantine or help with some things. But that's happening every day, 7 days a week, 12, 14 hours a day. We're doing isolation and contact tracing on each case. In terms of Falmouth and relative to Barnstable County, when we first started a couple of weeks ago, we jumped up to about 23% earlier this month of all cases in Barnstable County. That we're down to about 17, as I'll show you down a few slides down, that some other towns have had issues themselves, and there's an ebb and flow to this. And but right now we're at about 17. I think we should be somewhere around 14 if it was straight population. I think Falmouth somewhere around 14, 15% of Barnstable County's total population. Our weekly case trend, like I had this last week and I've added for this week, or actually one of my board members, Ben Van Mooy, does a lot of this for me. Thanks, Ben. You can see that our trend is lower. We were higher at the 4-3, 4-10 weeks, and we've sort of down to under 10 a week. And I'll show you further down that that's actually, we're doing fairly well with that. It depends on events, and as I'll explain to you that in a minute. Our total number of cases, you can see sort of a flattening, and hopefully that maintains some sort of a less than exponential growth. It does show that we have been somewhat tailing off, and hopefully we will continue that trend by remaining diligent. Barnstable counties, this is the data. If you look at the website up above this on the slide, barnstablecountyhealth.org. They will give you a daily update on this. It tells you the total number of cases positive in the county. So it looks like it's gone up about 40 or so since the 19th. Went up about 30 or so in the last test, in the last round. And there's been about 28. There's been 28 deaths. That changes daily. You can get that from barnstablecountyhealth.org. The heat map, this changes daily. For example, you see sort of the Bourne Sandwich area is red now. They've had an event. You see Brewster. Brewster has an issue with a nursing home, with a large number in the nursing home, so they're showing a lot more cases over a 24, 48-hour period. And so this heat map is based on recent cases in recent time. That changes and ebbs and flows, and hopefully Falmouth stays out of the red. Red would mean some sort of an event. It could be and unfortunately, from a nursing home, it could be from some event that occurred where there was some mass spreading and something sort of started a wildfire of cases. It does happen, and it happens, unfortunately, different places, different times. So this heat map is also on barnstablecountyhealth.org, and it does vary. It does change on a day-to-day basis. Another place I wanted you to go for information, really good, is every day the Massachusetts DPH, Department of Public Health, if you go to the COVID-19 site, it'll give you a daily dashboard. Usually sometime after 4, between 4 and 5 is generally when I see it. You'll get the daily counts, and it's got a lot more information over the past week. They've really enhanced it, and I've got a few slides to show you about that. So a lot of your detail, especially by county, is in here. This gives you the total number of cases as of yesterday, the total number of deaths, the 8% hospitalization, counts of currently in ICU is 1,000. Total number of tests are almost 200,000, and they update this on a daily basis. Other data they'll give you is by county. You can see that Suffolk is has the highest rate per 100,000, whereas the surrounding communities around Boston are all between 465 and 800, whereas Barnstable's in the 80 to 327 range per 100,000. So, Barnstable right at this point is holding their own. This chart, also from Ben, thanks Ben, shows the difference between Plymouth and Barnstable. If you look at Plymouth County in gray, Barnstable County in orange, and Falmouth in blue, you can see that around 4/3/20 to 4/5 or so for April 5th, we were basically the same number of cases. And you can see that, unfortunately, for Plymouth County, they've really taken off in total number of counts. They're somewhere up around 3,500. We're somewhere around 600 cases total. So counties are doing things differently, and that's going to be important for us when we get back to some sense of normalcy and we start lifting the restrictions. It's not just going to be Falmouth dependent. It's not just going to be Barnstable County dependent. For example, you can't open up a restaurant in Falmouth if your neighboring counties are still having a big problem. So we're kind of all in this together. So we're rooting for all counties to get better and level off, and we're rooting for Barnstable County to stay the course and start to drop. The numbers on these only go up because it's not dropping the resolved cases, but just to show you that cases per in population, I think it's per 100,000. In Massachusetts averages still 466 per 100,000 back in the 16th of which was last week, and then this week it's almost 667, so it's up 200 per 100,000, whereas the county's gone up about 75, and Falmouth's gone up about 30. So Falmouth seems to be holding their own at this point in time, and hopefully we can keep it this way. A little bit about the hospital. Cape Cod Healthcare has opened their step-down facility on Main Street. The Joint Base Cape Cod, as well as Brewster as well. The daily, if you're concerned about the hospital and their bed counts, it's actually part of that dashboard from the state. Shows you this, and you might not be able to read it that well on the screen, but it shows you the daily bed counts for COVID of every hospital in Massachusetts. It's about 3 pages long. For example, on the 23rd, it showed that Falmouth Hospital had 11 suspect and confirmed, with 6 in the ICU. So they're posting that on a day-to-day basis, or maybe every couple of day basis, and that can tell you how the hospital is faring, or any particular hospital in general. It'll also list on their individual nursing homes and how they're doing. They'll do it by less than 10 cases, 10 to 30 cases, and above 30 cases. So it's not an exact number, but you can see some of the nursing homes are having issues. So that's also on that dashboard. Things you can also get on the dashboard are hospitalizations. By age group, it tells you that the average age of cases reported as hospitalized is the average age of 68. It shows you the rate of confirmed hospitalizations. Obviously, we all seem to know this, is that it's with the older population, and you can see the data right there. And it gives you a lot of these different charts and so forth, which is, if you're interested in that kind of stuff, that's the place to go. A little bit about Barnstable County Health and the testing site. Continues at Cape Cod Community College as a drive-through. Hours are Monday through Saturday, 9 to 5. Your physician would still determine the need and schedule with Cape Cod Healthcare, and the testing center would get back to you with a date. Final slide, again, is about social distancing and personal hygiene. We're maintaining the course with social distancing, and the Governor Baker's obviously extended the orders. Schools have been canceled for the season. They're still both as important as ever. It is definitely working. The number of cases would be at least tenfold, in my opinion, higher without it. Part of the things we've been dealing with are the face covering advisory. I have sent that out in several different medium and to all the establishments that are currently open with the state's advisory. On Monday, the Board of Health joint meeting with the Board of Selectmen will discuss the resident requests for mandatory face covering. So we've received some requests to be mandatory. So I'm going to put that into the Board of Health's lap on Monday for them to decide what they want to have for above and beyond what the state is currently requiring. Again, important things are being aware of your health and staying home when ill or when you're starting to feel ill. Obviously, the asymptomatic people are aside. A lot of the transmission would be someone continuing to try to stick it out, maybe go to work or go shopping or whatever when they feel ill. Again, hand washing, hand sanitizing, social distancing, cleaning and sanitizing, all the same things we've been talking about, and it still remains. Anybody under isolation or quarantine, please, again, I'm going to ask every week to mention this. Please take this very seriously if asked to do so. Nothing more frustrating than having to follow up with somebody who's not following that. Again, only the case number and disease trends will tell us when we'll be able to return to some sort of normal, and that's going to come from the state and from the region that we're combined with New Jersey, New England, and New York. I've been doing a lot of calls and talking to a lot of people that have events this year, things like the road race and Cape Cod Baseball League, and we're working our way through all of them. They're all difficult decisions that we have to make. So I've been in contact, giving advice on that to a lot of different entities looking to do different things. And so that's what I have for a presentation today. If anybody, again, you can email me if you have anything you want me to cover specifically in these things that I'm doing every week. So I repeat, sorry, some of it's a little bit repetitive, but again, we're just trying to stay the course, and hopefully we can start seeing some good results from it very shortly. Thank you.